Well, let's talk about this with GP Dr Helen Wall. Helen, good morning. Dr Wall, good morning to you. How concerned should people be about this rise in cases?
Well, the rise in cases is not a new thing. We do tend to see that whooping cough cases rise every 3 to 5 years. We last had a peak in 2016, so we are overdue a rise in cases. I think the concerning bit is that we are seeing less and less pregnant mums and also babies being vaccinated against this, and it can be really serious for particularly babies under 6 months and particularly those very young babies who haven't yet been vaccinated if mum hasn't had the vaccine, which has given them that protection. So it is worrying.
What's the concern with very young babies and their proximity or if they catch whooping cough?
So whooping cough can cause very severe illness. So it's a bacterial infection. It gets inside the small tubes of the lung. It can cause significant breathing issues, but also young babies can become dehydrated, get pneumonia, even have seizures. And then sadly, as we've seen, it can be fatal in the worst case scenario. And the problem is that babies can't be vaccinated themselves until 8 weeks old, and then they need 3 vaccines, one at 8 weeks, one at 12 weeks, one at 16 weeks to protect them against whooping cough. So the aim is for, if pregnant mums can be vaccinated between 16 and 32 weeks, mum then develops that immunity, she develops the antibodies, and those antibodies then pass across the placenta and protect baby in those first few weeks when they're not able to be vaccinated themselves.
Is there a push amongst GPs now to contact pregnant women to encourage them to have the vaccination during that period?
Yeah, absolutely. We'll be encouraging pregnant women to have the vaccination, but also maternity services, antenatal clinics. Many of them across the country can vaccinate pregnant women, and midwives have been doing this for a long time. This vaccine's been around for well over 10 years now. So there are processes in place. Unfortunately, we have seen a drop-off. I think, 2023, we saw 70% of pregnant women taking the offer of a vaccine, and in 70% in 2016 and gone down to 58% last year. So a significant drop-off in pregnant women, and we all need to play our part now in encouraging that uptake. And talking about whooping cough, because I think we've taken our eye off the ball a little bit. We've talked a lot about COVID and measles and all sorts of other infectious diseases, but we've perhaps not had those conversations enough, and we need to raise that profile now and say that actually it is a serious illness that we need to be mindful of.
Stupid question, Helen, and just briefly, how do you know if you've got whooping cough and just not a cough?
Well, it's really hard, isn't it? And it's like any of the infections with respiratory diseases. You don't really know. Usually, once it takes a hold of you, you get what people refer to as the 100-day cough, and that's when it becomes more obvious. But in babies, you tend to get this whoop, which is why it's called whooping cough. So the cough becomes a very distinctive noise, and like a whoop kind of sound. So there is a distinctive sound to it that might alert people, but initially it just presents as cold, fever. That might not be feeding as well, and then the cough will start about a week later, and the breathing issues. So it is very difficult to pick it up early on, which is why we just need to try and prevent it in the first place. It's much easier to prevent it.
Dr Helen Wall, GP, thank you so much for your time with us here on Breakfast.
Thank you.
Time now is 9:25. You probably got a hunch about what our next story is about. These are African penguins, and